I always appreciate that, to be able to see you. If you're driving, do not turn it on. Just send me a message and let me know when you are capable to, okay?
Professor Bogart, I'll be home in literally 5 minutes.
Okay, thank you very much, Isabel. Appreciate that. This is week 2, and we're going to be going over infants, toddlers, and preschoolers. And the interesting part is understanding the growth and development of those age groups and what milestones should they be able to do. Also, we're going to be going into the theorist and looking at what does Piaget mean and what does Kohlberg mean. And I'm going to try to give it to you that you will be able to understand it, not just the words of, the way the book has it listed. I'll give you some examples. So I did read all of the discussion questions on 3 of the classes already. I did Monday's class, both of them, and today's class. So if you go back and you look at your discussion question and it's not a full 20, that means something was not completely correct, which means I want you to go back and look and see what I told you, because I did write a comment on every single one of you. What I found mostly is this. There were some students who didn't answer the discussion question fully. They told me all about yourself, which was great because I really enjoyed reading those things. Some very personal and very nice things, that I heard. And of course, all nurses want to care. And just like me, that's what I wanted to be. But it didn't go into the answer about nutrition. So when you're answering discussion questions, make sure you get all components, okay? The second thing is mostly I didn't see citations within the body of your paragraph or paragraphs. I did give you an example. We know our book is Perry, so I put parentheses, Perry et al., 2003. This should be somewhere in there with information you're sharing with me, okay? And this just shows me that it's not you who gave me information, you found it somewhere, and that's proper APA. I don't go crazy about complete site references. I like to see them, fairly decent. If anybody is having any issues with that, though, please meet with me, or I can send you examples on what to do. We also know that there is Purdue OWL online, a great source for you to go and to look at also. If that doesn't help you, you don't get it. Because, when I heard it was the American Psychiatric Academy or something, and or psychologist, I forget what the APA stands for. But I remember when I went back to school, I'm like, what does it have to do with writing anything? I'm like, what? I don't get it. And I was so confused because I went back for my bachelor's. I had to learn what all that stuff meant. So I understand how crazy you can get because I've been there. And it's really not that long ago. It's 2009 when I went back for my BSN. So I get it. So if you need help, let me know. And then the other thing is some students did write and didn't write a reference. So make sure you write a reference, a citation, and you answer the full discussion question. So if you see less than a 20 again, go back, look at it, and it tells you what you've done. And I've made some comments to those students who had some questions also. So hopefully everything has been answered. One of the comments that kept coming through was, am I going to be doing reviews? Yes, we will. I am setting them up for all next week. There'll either be 2 or 3 reviews, and you will get the recordings for all of them. Other professors, you'll be getting the Zoom links, etc., the times, and I will post it on your calendars with the Zoom link. So you should be able to find it extremely easily. I figured out how to be able to do that on your calendars so it can assist you, okay? So that was that thing. Now, I've had a question also regarding the Pediatric Assessment Project. Now, the Pediatric Assessment Project is not due till March 6th, but I know that when you get to March 6th that week, there's an exam around there. You've got a community project. You've got all of this stuff that's due, and it's, it gets really hard, especially with most of you are in 3 courses. So as I said, you have some things open. Case studies do not open till the week they're due. Burn opens next Sunday. okay? That was a question that came through this week also with some students. I don't want you to go too far with the case studies. I tried to hold you back, but your NCLEX questions are open, your Kaplan's open, your discussion questions are open. So I've given you a lot of that stuff to do. Also, your project, you can turn in at any time. Now, in the project, there's 3 components. I want you to choose either a made-up child or somebody you knew, and you can give me a diagnosis that relates to pediatrics. It could be asthma, it could be ADHD, it could be seizures, could be cerebral palsy, could be a syndrome, doesn't matter. Make one up. You know, look at something, maybe you knew someone, maybe you, your sister, your uncle, your aunt, your neighbor, whatever, had a child with something. Now you can research it. The first thing you'll do is write a 250-word APA paper, okay? And just describe the condition. It's not a lot. Just make sure you cite in the body of it. It is a cover page one you could put on there. And then it's a reference in the end. At least one, I would put 2 references in when you're doing a diagnosis, okay? So cite that somewhere, those 2 references within the body. Then you're going to do an assessment. The assessment is a form that you can print from the module. It is there, print it off. And what I want you to do is do a physical assessment, and it's actually like a home type of inspection assessment on your child. Do not leave blanks and do not tell me not applicable. Put something there. Everybody has lungs, everybody has a heart, everybody has, you know, a endocrine system. Make sure you put something there. And then the third thing you're going to do is either a PowerPoint, a project board, or a pamphlet teaching either nurses, parents, or a child on their condition. You could teach them how to give an inhaler. You could teach them how to give a gastrostomy tube feeding. You can teach them about what you need to do for a child with ADHD, a child with seizures, what to do when your child has a seizure. The PowerPoint, 5 slides is more than enough, okay? You don't have to go bonkers and give me the 30-slide thing. Just be, you know, clear, specific, again, with a reference in the end. I want to know where you get the information. Do not go to the internet, copy and paste something and give it to me. It is ran through a checker before I even look at it. Unicheck, I believe it's called, that's within the body of the submission. As you submit it, I get how many % plagiarism. Now, if you do something that's not up to par, I will let you know. You can change it. You can get a better grade, okay? I've had many students and it's an unlimited submission. So you don't have to worry about, well, if I submit there, it's not going to submit when I want it. No, it's unlimited. So send it in. If it comes back, you know, that let's say it's plagiarized 80%, and I've seen 80 and 90%, I will let you know. Take that information, put it in your own words. Please put it in your own words. And then put it back to me. It goes immediately back through the plagiar checker and I can look at it. So that's with the paper, that's with the assessment, and that's with the PowerPoint. All of those things are run through the plagiar checker. So I will let you know what your grade is. If you don't like it, then I have told you what you need to do to improve it, because I want you to get the perfect 100 on there. This is 6% of your subjective grade. I would love to you from go to a C to a B or a B to an A or A- to an A. I mean, I've seen all those things happen. So I want that for you. So I will tell you, if you want to change it, you may. If you don't, then you'll get the grade that, you know, originally was put in there. Okay. Does that help any misunderstandings or help you understand more about that project?
It does.
Okay,
Yeah.
so you're good with it.
Professor
Okay,
Butler?
remember, let me know any diagnosis you want to do. Okay, just send me a message and I'll let you know if it's a good one. Yes, Lewis, you had a question.
Where in the modules would you find the assessment sheet?
Hold on. It's under pediatric assessment. I believe it is. Week 7. It says to prepare the clinical assessment, and it is due by the 6th. I have it in the module listed as 7, so either 7 or 8, it's in there. And
Thank
I've
you.
checked it, I've looked at it, and I know it's complete. We did it a little differently this semester, and it's all within Canvas. So I was excited about that because I didn't have to send you, a message which everybody would lose because all of the other messages, and they have to resend and resend. So this is all in one place that you all will have. Okay.
I have a question concerning the quizzes.
Yes.
So, the quiz, after we complete it, we can't see like what we got wrong to know for the future.
Okay, so what you can do is ask me, and I would love to meet with you to let
Okay.
you know, okay? I mean,
Okay.
it'll take a couple minutes. I'll tell you what was the one.
Okay.
We do that because many questions we will reuse next semester. But this semester, this term, they're all changed completely because they had been out there for almost a year. So they're all changed, and next semester we'll change 2 or 3 of questions. We'll see which questions we don't like or we want to change or what we should put in there. So that's the reason why you don't see them right away. But
I have a question.
yes,
I did not take my quiz yet because you said you want us to attend the
absolutely.
lecture.
I agree.
Okay.
Right.
Absolutely.
Okay.
You want us to attend the
Absolutely.
lecture first, so I just
Well,
wanted to make sure.
If you're taking a quiz on this week's information, it would behoove you to listen to it. You should have hopefully at least the interactive PowerPoint, right? You come here.
I did, but like last semester is the same thing. For OB, they wanted us to take the quiz after we do the lecture.
Mhm.
So since I see you send the message like we can attend a lecture today, Thursday or Friday, so that's the reason I didn't do it.
No, I absolutely, you shouldn't have done it. You have till Sunday.
I went
Okay.
into the quiz thinking that since it's the week 2 quiz, it was going to be based on the information for last week, which was, yeah. So I didn't,
Like you say.
because
All right,
that's
you'll
how
never do that again. You'll
Canvas,
never
yeah,
do that
so
again.
I didn't do as well as I wanted to, which is why I wouldn't like go over it.
Oh,
because,
absolutely, absolutely.
yeah, because in the
Ariel.
past, usually like when the quiz is quiz 2, like it's from week 1. Like when I go into med search tomorrow to take the quiz, is gonna be what we learned last week. So
Okay.
that's what I thought it would be like I didn't think that it would be based on this week. So I was
Maybe
like
I didn't
confused by that.
emphasize it as well as I should have. Make sure, I mean, one student did say to wait till after you go to class because it is this week's information. So you did your interactive PowerPoint. I am going to do a
Yeah.
PowerPoint. I'm going to do
The
a Kahoot.
interactive is what kind of saved me, why I did, okay. But I know that now that if I had stayed for this lecture, I probably would have done better.
Yeah, well, this is a way we learn in anything. Sometimes you have to make a little oops to get there. It's not going to affect you crazily, so don't worry about that, okay?
Okay.
We will make sure that you do better on your next quiz. We will make sure that you do good on your exams. As long as you're doing what I'm telling you to do, you all will do very well. So anyway, on that note, any more questions?
Professor Kober, I have a
Yes.
question.
Sure.
I know usually on exams, we have dosage calculations. Now on quizzes, do we have them as well?
No.
Okay.
No, you will see no dosage calc on any quiz at all. Okay, because I've made all the quizzes. Nope, they're not there. Only on
Okay.
exams. And again, anybody who needs a review on dosage calc, I am somewhat of that expert to teach you because I used to teach pharmacology. And I can teach you very simplistically. Those here from Cutler Bay had me in pharmacology that I'm seeing. So they know how I teach. I do it very simple and I do it basic and I build you up to where you need to be. So anybody who needs help, I'm always here willing to help you. Just reach out, send me a message and I'll help you.
Okay, question.
Sure.
Which day would you'll be available?
I am available on Wednesdays and Fridays for sure. Around noon on Tuesday and Thursdays usually. I'm trying to fit
Okay.
what meetings are where. So You tell me when you're available and I'll tell you if I can. How's that
It's
sound?
all right. I'll shoot
All
your
I ask
email
is
then.
not too early in the morning. I'm not a
No,
morning
I will
person.
definitely shoot your email after the class.
Okay, perfect. That would be
Thank you.
great. And if you want any of your classmates to join you, please.
Well,
know,
I
bring
will
them
try to
in.
do Thursday, guys.
Okay.
So I'm gonna shoot about Thursday. So if you guys want to do it, we can do it. So
We can do it this Thursday, next Thursday, or both, whatever
it
you
would be
need.
this Thursday. This Thursday would be best because we basically have I basically have 3 exams back to back: Monday, Tuesday, Wednesday.
Okay, okay, I understand.
Would it
Next
be the
week,
same Zoom, Professor?
always the same Zoom. I
Okay.
haven't
Okay.
changed Zoom in over 2 years. I am the
Okay.
same number.
Perfect.
I'll send you an email and it will be nice for me.
Okay, perfect.
Thank
No
you.
problem. No,
Can
you're
we
welcome.
record it? The math session? Can we
I
record it?
always record it and I will send it to everybody.
Thank you.
Okay, so that you can have that review. Yes, I do that. I mean, I asked the students first, do you mind? They're like, of course I don't mind. I want to help out my, partners, my
Yep.
buddies in crime. I need to help. So yeah, I do ask just because, it's not nice. All of a sudden you see your face somewhere in somebody else's computer and you didn't know you were recorded. I wouldn't do that. All right, let's go to our first PowerPoint. We're going to do, it's all in one. I sent this to you. You got it Sunday. So as I said, I will get these to you earlier so that you do have them. So we're going to start with infant. Now, remember as we're going over the different age groups, what you need to know. You need to know growth and development milestones, because if we haven't met a milestone, that means there's something wrong. That means something that we need to do, an early intervention and calling the physician, etc. So if, for instance, if you had an infant who was 1 year old and couldn't roll over, there's a problem. They couldn't lift their head up in 6 months, there's a problem, okay? I mean, just people who just know common infants and children know this, there's definitely something wrong, but there's a lot more stuff and we'll go in there, okay? So as I said, when we talk about the infant, we talk about, this is on a, okay, I'm going to need help getting me off of here. Transitions, where is it? I had one do it last semester. And we want to,
Where it says after, uncheck that box so it's
And-
only on mouse click.
on mouse click. Okay. Thank you. I appreciate that. I knew it was somewhere there. Remember, I'm not a really technical person, although I've done very well for somebody who's not technical at all, but I do need help. So I appreciate the help all the time. So thank you for your patience. So infants, there we go again. Why is it doing it? There's something else there. Under transitions.
You have to put it on none, Professor. You have it on fade.
Where? Here? Oh, here.
But also like where it says after, it rechecked it for some reason. And then
I
where it
saw
says
that.
duration, see if there's an option that says like on click or something like that. No, it's just time increments. Yeah. Go back to auto, I guess. That will probably, and then
Is
hit
it
apply
then?
to all. Hit apply to
Oh, okay.
where
It's
it
not going
says,
to be here.
yeah, like right under duration, but don't put the 0.1, put auto, I guess.
I was trying to get there. It didn't go.
Mm. Just, I guess, yeah. Hit apply to all and see if that,
It didn't go.
see if that fixes it now though, that after is,
Let me see with that, with the none, with the thing off, and let's try again. We can do this.
Hello.
All right, let's see.
Girl, in my 3 to 5 class, girl. What's up?
Mariah, I can hear you. I turned you off. I think we're there. Okay, thank you so much, guys. I appreciate you. So infants, we have a baby's born and literally they can barely hold their head. You have to hold their head up for them. They have no strength at all in their body. So the first year of life is the most dramatic changes, the most growth that we see, and especially with the central nervous system. You know, we have a few reflexes, you know, the little rooting, you know, when you brush your cheek, they want to look for a breast or a bottle, you know, when you make loud noises, the startle reflexes, that's it. And then as we go on, our central nervous system gets stronger and it grows and we can lift our head, turn over and walk, and all that's part of that. Initially, we know that babies lose about 10% of their body weight. That's just normal because you're floating in water. A baby sucks up the water and is full of water and they'll lose it. But then after the first week, they'll start gaining 5 to 7 ounces per week. The things that you will see questions on is always about doubling the birth weight by 6 months and tripling by a year. And this is one of the assessments that we do on every single visit with a child. There always is a height and a weight, whether you're in a doctor's office, an emergency room, an urgent care, you always have the triage person get a height and a weight. Now, why would I want to know that a birth weight was, let's say the baby was born at 6 pounds, and now the birth, you know, 6 months later, they weigh 9 pounds. Well, if it was 7 pounds and they're 9 pounds, that means they're undernourished. It's a failure to thrive. They are not getting the nutrition they need to feed that central nervous system, which is growing. So you're going to have cognitive delays. But conversely, if the baby was 7 pounds at birth and at 6 months they're 20 pounds, we're overfeeding. So what are you doing? What formula are you on? Or breastfeeding, are you giving something else? Are you giving juices? So those things can be held off so the baby won't be as heavy, because obesity can happen, you know, that start of it early. So double at 6 months, triple by a year. Now, when we're born, you've seen those vital sign sheets. We know an infant's heart rate is 140 to 160, and the respiratory rate is 40 to 60 at birth, and that's at rest. I mean, we know it could go to 200, you know, if they're crying and screaming, and that's normal. But as we get older, by 1 year old, you might see the heart rate down to 100, 120. And then by the time we get to adults, it's 60 to 90, 60 to 100. So it keeps going down. Your breasts, you know, lungs will get bigger, you know, you are able to oxygenate better and the heart beats more efficiently. So everything starts to come down. Another thing that happens is when a baby's born, he has a hemoglobin hematocrit and the iron that mom gave him. Now, for the first up till about 3 to 6 months, the baby's not making their own cells, but the cells they have in their body are dying. So what are you going to see? It's called a physiologic anemia, which means the hemoglobin hematocrit have gone way down. It is not abnormal to see a 6-month-old child with a hemoglobin hematocrit of 10 and 30, 9 and 27, 8 and 24. That is normal because the body hasn't kicked in yet, okay? We know that the one thing that's important is we got, you know, all the iron we need from mom initially, because, you know, the iron, you know, keeps us healthy and it's carried in the hemoglobin. That's why we are going to be given supplements to infants. And also if it's formula, even when we introduce the first things at 6 months, which is cereals, it'll be iron fortified so that that baby gets enough iron, you know, to be able to sustain themselves. Initially, the head is huge. You know, we talked about that, you know, a little bit. You know, the heads are big and then their chests are very small. And that's normal. By about 1.5 to 2 years, the head should be smaller than the chest, or at least equal to it. So we've got this big head and we're growing, and we have these soft spots in the top and the back of their head, and they're called fontanelles. Now, the posterior fontanelle should close about 6 to 8 weeks, and the anterior by 12 to 18 months. We will be checking those in the assessment to make sure that did they close or did they close too early? If they close too early, can that brain grow? It gets squished in there, right? So there's the importance, or if it's open, why? Is there hydrocephalus? What's going on? We need to understand it. When the baby's born, the digestive system is extremely immature. That means if we try to give them anything, food, fruits, vegetables, cereals, before 6 months, you'll see it come out in the stool. The baby can't handle it. We will see, all the traces in the stool, and there be no nutritional reason why they need it. So that is why they only get breast milk or iron fortified formula for the first 6 months of life. Then we will introduce slowly the other foods. So as I said, baby, the systems of the body, they're tiny, they're small, they're immature. We can see how they grow. Anybody who's been around an infant knows that when they're first born, they can barely lift their head. And at 1 year old, they're running around the place. Like, how did that happen in 12 months? It's like so remarkable. And the central nervous system goes, crazy by using all of the nutrients and vitamins and et cetera that they have, to be able to do this sort of thing. Now, mom is given the baby all the antibodies that they need intrautero. Now, when we start giving immunizations, except for hepatitis B, that's given at birth, usually in the hospital or at the first doctor's visit. And that usually actually only depends on insurance when you can give it, whether it's in the hospital or the doctor's office, believe it or not. But about 6 to 8 weeks, now the body can start making their own antibodies. And that's why we start giving those immunizations. It's 2, 4, 6 months. Those you're going to see so many loaded on. And then you'll see about 15 to 18 months more of them. And there's a reason why we give them so early. Because literally a baby is born and they don't have much of an immune system. So we want to protect them from those really, really bad sort of diseases that are prevented by immunizations. Now, when the baby is born, they cannot control their heat, which means for us as nurses, why? Well, the baby doesn't have a lot of adipose tissue, all that big, fat, chunky stuff that we get with that cute little chunky little baby in the cheeks you want to pinch. That's when they can hold their own heat in, but that's why a baby is placed immediately onto a warmer. And on the warmer, we do our assessment. And if it's in a place where we don't have a warmer, we will be sensitive keeping a blanket on that child because they can get cold very, very, very quickly. Their renal system, again, the one thing that we worry about the most as nurses with infants is dehydration. You can have an infant and they can have 1 or 2 vomits. They become dehydrated and it really affects the kidneys. It's very important that we do look at the urine output on infants. So how do we measure urine output on infants? They pee in a diaper, right? So we have a dry diaper and we weigh it. Usually size 1 is 30 grams. So we take it off the baby and it's wet and full of stool and we weigh it and it weighs 65 grams. Well, that's a difference of 35 grams. That is 35 mLs of output. And that's how we document output on infants to make sure that they're having the 0.5 milligrams per kilogram and making sure that their kidneys are continuing to function, because we do need to make sure that they have enough hydration. As I said, the central nervous system is that fastest growing system in infancy. It has to do with the nerves and the myelization and all of that. And basically what it does, it makes the body strong enough so that they can stand up and they can walk and run. Basically, that's what it does say. So we know also central nervous system has to do with cognition. What can they do? Those fine motor skills to be able to do involuntary grasp or a reflex, palmar grasp, and then it goes into a voluntary, I'm going to grasp that rattle, and then going into a crude pincer grasp to a fine, and then building blocks and putting them in containers. This is all part of the central nervous system, all making your body strong enough to be able to have the understanding and the physical ability to be able to do that. So here we go right now, the palmar, the transferring of grasp, the pincer, removing of objects, and the tower. So usually we get to the point of pincer grasp right about 10 months, and then 11 months the container and the blocks, usually by a year. The palmar grasp, the one that first happens is that baby will something in their hand, like your mommy's finger, and they, oh, look, he's holding my hand, isn't that cute? Well, that really is an involuntary or reflex palmar grasp. And this is part of the development as professionals, nursing professionals, will be looking at when we assess these children. A baby is born and they can't lift their head up. They should be able to lift their head up by, 1 month, 2 months at the latest. They should go from belly to back about 4 to 5 months, and back to belly 5 to 6 months. If they're not doing that by 8 months, there's a problem. Again, these are growth and development milestones that you need to be able to pick out of a question, saying, so what are you going to do when you see? Sitting should be 8 months sitting unsupported. And then going from back to sitting up is right around 10 months. So these are important milestones that you will see in infants. They usually are up on their hands and knees somewhere about 6, 7 months, crawling by 8 months, walking with assistance, about 9 months, and they're cruising around the couch, etc. And by 1 year, they should be walking alone. Now, it doesn't mean if your infant is not walking by 12 months old that there's a problem. I'll give you the example. My grandson, he never walked. At 15 months, he ran down the hall, okay? As long as all the other growth and development factors were okay, it didn't mean that he was behind. It just means every single child grows at a different time frame, but as long as they're moving forward, they're doing okay. Now, Erickson talks about trust versus mistrust. And what it means is this infant knows when he cries, somebody's going to come in. He knows if he's hungry, he's going to be fed. If he needs to be burped, he's going to be burped. And he knows his diaper is dirty, it's going to be changed. It needs, all of his needs are being met. The mistrust is when he's there crying and nobody comes, or he's left hungry, or he's left alone. He does sense that when he doesn't get the responses he needs. They say the first year of life, you can't spoil a child because their needs must be met. Now, Piaget, in the initial part of the concepts of Piaget, it's similar to Freud, okay? Because it's that sensoromotor, that means touch in the mouth and playing with it. Freud talks about oral, everything biting, chewing, oral, that's satisfaction, that's a stress reliever. Piaget in the birth to 1 month is we start being able to grasp something and start to be able to take it, put it in the mouth, and then starting after that to be able to move it around places. So that's all about Piaget. That's when, you know, you go to a kid and you ever go to a little infant and stick your tongue out and go blah, 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 and all of a sudden you start to see their little tongues come out. That's imitation. That's talking about primary circular reactions in this infant, okay? And then when you say peekaboo, okay, that's an effect, they're going to giggle. That's the secondary circular reaction. So there's different components within Piaget. Now, as I said about object permanence, what is it? It means that even though the toy is missing, that it went somewhere, a child knows it's still there. He'll go back to the toy box and pick it up when you put it away because he knows the toy's there. Or the infant knows that he saw what he wanted, that colored thing over there, and he'll go over and grab it when it's covered up by something because he still knows that it's still there. We know body image, you know, is part of that it's a great thing to put a child like this little child here in front of the mirror, and they're trying to touch themselves. And it's basically touching and looking and understanding, you know, the reflection. And it's they get interested in it and seeing that when there are moves, the mirrored image moves, etc. We know infants do like usually the caregivers, whether it's mom, dad, grandma, aunt, uncle, grandpa, whoever it is, you know, and they know that if you try to take a child away, for instance, child gets brought into the doctor's office, you must pick up the child and put it on a scale. The child might start to cry or turn around and try to reach mom or dad. It's just part of that attachment. Also, you have a child has to go to daycare. That's life today. Two parents got to work. Children got to go to daycare. You know that when you leave that child with that person, they tend to understand mom and dad's going away, and that separation anxiety, okay? They want to stay. And then, of course, they cry themselves, and the caregiver there picks them up and they settle down. Stranger fear. Now, if you are in a group of people and some person that the kid doesn't know comes, wants to hold your child, it's your best friend, you haven't seen for a year, and oh my God, there he is, the baby, pick them up, and they're turning around and they're grabbing mom again. Stranger fear, and they know who their caregivers are. They know who's not. And it's about 9 months that it becomes the most evident. Their social development, we know it starts with language. I mean, what's the first things baby do? They coo and they cry. That is part of their language. They're talking to you. They're saying, hey, I'm in here. I woke up from my nap. I'm hungry. Change my diaper. And they're crying. And that's all the things they're doing. Play is so important. I can't even, you know, tell you how much play is important to infants and their growing and their cognition and learning. Very, very part of it. We know that their temperament is going to be, you know, a part of that Erikson trust mistrust. Are they in a trusting relationship? Are they getting their needs met? The baby's going to be calmer. And you're going to see the difference between a child whose needs are met and a child whose needs aren't being met. The ones aren't being met are going to be fussier. They're going to be crankier. They're going to be crying more. They're going to be harder to soothe. And there is a questionnaire regarding that if it becomes a problem. So as I said, the first 6 months of life, mom's milk or iron fortified formula is the only food. So when do you know that they're eating enough? Well, I know that I've had many parents that have premature babies, and you know, they're pumping their milk and they're giving a bottle, and they could see how much milk goes in. Then all of a sudden we're like, here, breastfeed your child. They're like, well, how do I know what they took? And how am I going to know at home? And I don't have a scale and I need to weigh. And I'm like, no, you don't. What you need to know is at least is there 6 to 8 wet diapers every day, your baby's getting enough nourishment. Okay, we know that. Another thing we could tell them, you know, that little soft spot up there initially, as long as it's equal with the head, we're good. Now, if it sinks in, depressed fontanelle, that's when you see dehydration. And that's what we'll be looking at. And as we go to the physician's office, getting our immunizations 2, 4, 6 months, we'll be weighing that child. And we will make sure that they do get an increase in weight every time they go. Some children grow quicker than others. And a vitamin D is very, very important to these children. So as we go on and we start introducing foods to these children, you know, the second 6 months of their life is now introduction. Now, there are physicians who say fruit first, some say cereals first, some say vegetable first. You know, it doesn't matter. It's a selection of food. We know that these babies are now eating a lot of milk, whether it's the iron fortified formula or breast milk. And now we need to give supplements because, you know, this is a lot of breast milk for those breastfeeding mothers. So this helps with the amount of milk that they'll need. They'll need a decreased amount. So give mom a little bit of a break. But what we do is start with one food, and we shouldn't change it for 3 to 5 days. And then we need to look at the infant. Has there been any change in that child? Has the stools changed? Do you see any rashes, dermatitis? Because You will see that with the introductions of food. Once that food is okay, then you introduce another food. So it's a slow putting on different foods, but you will see what foods that they tolerate by doing that. Sleep. Infants and adolescents are those groups who should sleep the most. And why did I say adolescents? Do you know, in the pre-adolescent, the adolescent growth, they do 25% of their whole height during pre-adolescent. So they're growing quickly. Well, what do infants do? They're growing from 7 pounds to 21 pounds in 1 year. So it's that same amount of growth, and they need all that nutrient for the growth, not for expenditure, so they have to sleep. So when they rest, they're saving the food for all those other things, that the central nervous system and enable their cognition. And so that's why babies sleep a lot. They should nap a lot, they should sleep a lot. And we know one thing about breastfed babies. They say breastfed infants usually feed every 2 to 3 hours, and formula babies usually don't need to feed but every 3 to 4 hours. It's because of the extra vitamins, et cetera, that are in the formulas. Dental health should start as early as you see teeth coming through. Initially, it's just a wet, warm washcloth that we'll wash off the teeth with. After that, as they get older, we'll scrub them. They say it's the age a month minus 6 is the number of teeth, literally, but not for every child. There are children at 4 months which will have 2 teeth in, and there'll be 1-year-olds who have no teeth. Again, both of my children and my grandson didn't get a tooth by 1-year-old. They got 6 at 15, 16 months old. Can you imagine the amount of teething pain these children have? But it should be, if you're 8 months old minus 6, you should have 2 teeth. That is the normal book type thing, but it doesn't mean it's not always that way. These are all your immunizations. And you have a link that I sent you, which shows you a lot easier to try to figure these things out, because it's a lot of them. Now, do you need to know every single immunization? Do you need to know when they're all given? No. You need to know Hep B at birth, and you need to know the initial immunizations that are given. Also, are they a live virus or not? Why would we want to know if they have a live virus? Well, if they're immunosuppressed, they can't have a live virus. Even like adults, same thing with adults as it is children there. There is a big thing about immunizations and any reactions, and there isn't a reporting thing about it. And we know in any type of situation, adult or children, that the emergency management is that epinephrine. And of course, there's EpiPens junior and EpiPens adults that are given for any reactions that you might see. We know one of the side effects of immunization is they get a sore leg because it's given in the vastus lateralis, okay? And it might get red and hot and swollen and painful. So I tell parents, give yourself Tylenol when you get home to that baby, and you could give it every 6 hours over the next 24 hours. And then you sort of bicycle those legs so that you're working in that vaccine so it doesn't sit there and just get almost like a cellulitis, looking hot and painful, and it really, really hurts. Safety promotion and injury prevention in infants. There are so many things that we can do to protect their infants, and depending on what their age group is. Motor vehicle, remember, this is the biggest injuries. In children, the biggest injuries is motor vehicle. So making sure they have a proper car seat, that it's faced rear facing until they're 2 years old, and then they can turn them around, and making sure that they're strapped in properly. Many pediatric and many hospitals do have these what we call car seat days on Saturdays, where you could go in and you could make sure that your car seat is installed correctly. And I think that is great. I know down here in Miami, Nicholas Children's Hospital, they have a whole team who does it at least once a month. Another thing is injury at home. I mean, as your child.
You can also call
Yes?
the fire. You can also call like the police or fire department and go
Yes.
to one of the offices and they'll help you.
Yes, yes, very good. Thank you so much. Yes, absolutely. Another thing is that safety, and when your child starts crawling at home, they're going to start getting into things. So make sure that their things are small, electrical. I mean, it is a choice. Do you put the caps in the electrical sockets? Don't you? Well, there's like a two-train thought. Now, with my children, I put the caps in, and of course they would go and they always pick the caps out and thought it was a lot of fun. Now, with my grandson who lived here, we decided just to see what he would do without them. And he has never touched an electrical socket until we put one that was in an area that he could get to very easily. He would play with it. So, that is just make sure safety always with children. One of the special needs that we have in children, and I do not wish it on any of you, is a child with colic. These children, usually for the first 4 to 6 months of age, are crying because of severe gas. It is horrible.
All day, every day.
There's nothing you can do. You put warm packs, you give those Mylicon, some methicone drops, you add rice cereal because you think you need to keep it down, place on medicines, you rock them all day long, you put them in that swing to hope, you take them for car rides, whatever, and it's not a fun thing. Like, yeah, I guess you've experienced it because it's not a nice thing. You cannot console the baby. Another thing is this failure to thrive. Well, that's why we need to know the weights, right? 6 months double, 1 year triple. If we're not making those milestones, that means that infant's not getting the nutritional that they need. They're not getting it. So why? It could be just as simple. Maybe it's some sort of thing with the formula, or maybe the parent doesn't know how much to feed that child. Don't ever assume anything. Always ask all the questions. So sometimes we have to do these diagnostic evaluations. We'll do upper GI series and we'll look at the refluxing, et cetera, to try to prevent this failure to thrive. Then we have, because of today's SIDS. SIDS promotes that they should not be on their tummies to go to sleep. The program here in South Florida is back to sleep, which means they're placed on their back, which means the back of their heads can become flat. So babies' heads are actually very soft. Now, what they say is when the baby is alert, the tummy time is important because that will help equal out that flat head in the back. I mean, every infant's going to have that little flat look or that little missing hair in the back. It's just part of a parent doing their job correctly. Sometimes it could be, the infant was ill and, required not moving for long periods of time due to whatever, and they've got a really flat side. You see that football helmet? These are the helmets we put on to help equal and make those heads as round as we possibly can. Another thing is diaper dermatitis. Now, I've seen this happen for many reasons. It could be the creams that you use. It could be diapers. My children could not wear Pampers. My grandson could not wear Huggies because every time they put the pamper on, this caused this big thing. Another thing that can cause these rashes to occur is when you introduce foods. This could be the sign of an allergy, having these dermatitis. So how do we take care of that? Well, usually it ends up because it's nice and hot and moist in there, it's yeast. So we'll put nice satin cream on there. And the physician will say, wash it with cool soap and water, keep it clean, let it air out, let it have periods of time with no diaper on to allow the child to air it, and the cream. And then looking at the food and look at the diapers, was there a change there? Another thing is Cradle Cap, and that's that crusty scalp that you see there. And what we need to do is just do, every night you wash the baby up, or the morning, whatever the routine is, get them for the day or for the night. And while it's wet, you wash it soap and water, take a soft brush, and you can brush it, and you could brush it out, or a comb, a soft comb, and it will come out. Nothing hard, no scrubbing, but eventually it will all come off. SIDS is a very real thing. SIDS death used to be a lot more than they are today. And we do have less deaths because of the program Back to Sleep. They found that when a baby was on their tummies and they went to sleep, that they could puke a little bit or vomit. Remember, their heads don't lift, so they couldn't get out of it. So they'd smother in their own vomit and they would choke to death. Then they said they could be on their sides. No, because they felt they were inhaling their carbon dioxide. So now they're, got their respiratory system, and then they would die. So now they say only on the back, and you're saying, well, they could puke. Well, they usually will swallow it. They usually actually do a lot better on their back, okay? Now, what do we do for SIDS? There's many things. Well, you shouldn't have smoking around the child. You should have nothing in the crib, no pretty little bumper pads like I had when my kids were little, because they can strangle themselves on it. Make sure that the bed's not too soft, no extra blankets, no anything in the crib besides the baby. They don't need a blanket. Put a warmer onesie on them. Another thing is no cohabitating with your parents in bed. I actually saw, and this was one of the hardest things I've seen. It was a bigger man. He rolled over on his baby and he smothered his baby in the sleep. And I saw that baby come to our hospital. And I was like, wow, I don't know how I could live with myself if that would have happened. Okay. And there's a lot more incidences with SIDS, and there's some reading
They have those
about it.
baby monitors that you can buy that
They
actually.
have the apnea baby monitors right there. You see that? There it is. That's the apnea baby monitor. Now, these monitors are usually put on premature babies who've had respiratory issues, or in a child who's had a ALT or an apparent life-threatening event. What is an apparent life-threatening event, an ALT? Well, many times it's a period where they have a long period of apnea and they turn blue. Sometimes it's due to choking and gagging, and they choke and they gag because they're refluxing so bad. So what we do is we'll have these children come into the emergency room and they'll be admitted, and they'll be admitted into an intensive care area, and they'll be monitoring their breathing, and they'll be doing endoscopies and all sorts of tests to figure out, was it reflux going on? They'll do EEG, make sure their heads are okay. And these children will be sent home on a apnea monitor. Now, these apnea monitors are just a Velcro with two little probes, and it goes right around the nipple line, and it's connected to a monitor. And if the heart rate or respiratory rate goes too low, it is the loudest, most ear-piercing sound that hopefully will wake up even the most tired parent. So remember to always go through these Eriksons. So I've talked a little bit about Piaget, and I've talked about some Erikson today regarding the infant. So toddler. Toddler, who are toddlers? I think this is my favorite group of children. As I said, I call them my dive bomb kids. There's absolutely no fear, and they literally are in this intense period of environmental exploration, which means they're crawling and walking and underneath and around and in the closet, in the shoes, in whatever, underneath the sink, wherever, they're into it. I love when they get on top of the couch and they jump off and onto the floor, and and of course they get knots on their head, etc. It's because they are in that stage of that exploration. This is the age where they're no, mine, temper tantrums. Now, we saw that with infants, they grow really, really quick. They, at this point, they go to very slow. You're going to see them, they're, knowing their birth weight quadrupled, don't go crazy learning those things. Just know weight slows down. Height tends to go about 3 inches a year. And then, of course, the head circumference is going to equal the chest circumference. Their body systems are going to be a lot better. They're going to be more mature. They're going to be able to eat foods and being able to use them. We know that their immune system is getting stronger. They've got their immunizations. They've had ear infections and coughs and colds and fevers, and their bodies build up immune system towards it. We know that upper respiratory otitis, tonsillitis are extremely common. As I said, 1 to 3, they're swapping their spit. They are literally taking somebody else's toys that they just had in the mouth and in the mouth and in the mouth, and all they're doing is changing those infections from one kid to another. It's okay. They need that because they are going to build up those immune systems, okay? At this point, they're going to start to be able to do potty training. Starts usually with urine first, then it goes to stool. Stool is harder to control. I think this picture of grandpa sitting there trying to help his little girl how to pee, I think that's precious. Gross and fine motor development. We know that these children are able to do more. They are more coordinated than, of course, infants. They should be able to throw a ball by about 18 months. They should have both hands working 12 to 15 months. Their vision improves. We know infants start out with visions 1 out of each eye, so there's no depth perception. Then it goes to 1 depth that we can see everything. And we know at birth, black and white's all they see, and then they start getting colors. By it gets to the point of toddler, they're starting to see more. They're going to get that depth perception. They start to be able to hear, smell, taste, and touch more. Now, infants, have you ever tasted the food that they eat? Ever taste or smell some of the formulas and they just clump it down?
Sorry to bother
Okay.
you. Michelle Strovert, she said she's trying to get in. She was picking up her daughter from school, so she's like in the waiting room.
I don't have a waiting room to look at. Tell her to try again.
Okay.
Or I might have to wait till after the PowerPoint to let her in, okay? All right, thank you though, Ari, I appreciate that. Okay, so when you talk about infants and eating, they'll eat anything. If you've ever smelt or tasted the formula or foods, they really aren't good. And these babies just eat it down like it's, you know, the best thing. Now, as they get to be toddlers, their taste improves. That's why many toddlers, there are chicken nuggets and macaroni and cheese by the time that they're 3 years old. That's all they want to eat because they love the taste. They don't want to eat the vegetables and the fruits and whatnot, just because this is their increased better of, you know, their taste buds. They like to play with their food, textures of food. All of these things start making a big difference. So Erickson starts with shame versus doubt. Now, for instance, when you have a child, an infant, they can go over, they can't do much about doing things for themselves. Now, ages 1 to 3, toddlers, they're starting to be able to do things for themselves. They can go to the drawer and pick out a shirt. They can start saying what they want to eat. Do you want this or this? They go pick out their own toys. And of course, that potty training is being done. Now, toddlers must be in rituals. That means in the same thing every day. They do not like to be out of that ritual. For instance, they like to have their nap at a certain time, their bath at a certain time, their foods, everything should be the same times. This is why it's hard to take a toddler on vacation, because you're taking them out of their normalcy. Preschoolers are not as bad, but toddlers, this is where they want to be able to have that sameness, so they know what's coming next. You know, they know when they do things wrong, you know, but they're still going to do it because they're testing. That's Erickson. There's sensoromotor. This is taking, I think this is great, this tertiary circular. Mom went to the kitchen to go get something, but the baby didn't want the mom to get up. So they took a cup or whatever and threw it on the floor, because they knew as soon as they did, mom would come back and say, hey, why did you do that? And put it back on their tray, right? They know how to call parents back. I think that's awesome. You know, in the very beginning, we talked to 1 to 4 months. We talk about anything oral. This is just pleasure for them. And then 4 to 8 months is that they know if they shake a toy, you're going to hear the noises. So these are all the differences and changes that you see, in the sensory or motor things going on. Their body image, they're starting to know who they are. They're starting to know that they have a penis or a vagina. They're starting to understand at about 2 years old. Or they're saying, why do you sit down to pee? Or they're looking at you while you're peeing, like, and you're a boy and you're standing up. They just not understanding these things. They're starting to understand ears, nose, belly button, hands, feet. They're starting to understand those body parts. Another thing is when we're talking with toddlers, they understand when you say something like, your baby's getting fat, or, oh, that is ugly, or those clothes, that's ugly. They need something. They're starting to understand these things. We don't want anything negative on children right now. The gender identity. So as I said, exploration is normal. I mean, they say today to use the proper words. Everybody has their own thing. My grandson who just came through my house with this, there was a vagina and a penis, and that's just what it is. And we know that at this point, they are going to start with that touching of themselves, and it's okay. So let's say you're a nurse and you're going into a room to take care of a child, and this little 2-3-year-old is sitting there sort of with an animal stroking themselves between their legs. So you wouldn't go say, hey, that's nasty, don't do that. No, you just turn around and say, I'll be back in a couple of minutes, and then come back, because it is all normal. So we know toddlers know mom and dad, and they want mom or dad with them at all times. And we know that children have things that can help them through rough times, whether it's a blankie, whether it's a teddy bear or a toy, whatever it is. And these are things that help them to be, by themselves, to be those individuals. As their language grows, they can speak a lot more words. They can express themselves a lot better. Might be as clear as you want, but they're starting to express it. They're starting to be able to feed themselves. Now, they pick a spoon up and it's the wrong way up and put it in their mouth. There's nothing wrong with the child. This is part of that exploration. They might get it in their hands, in their hair, down the front of them, but as long as they're trying, it's part of developing that independence. And another thing, I don't know if you've ever seen it, have a little 2-year-old, mommy don't feel well, and they come up and they give you a hug. So that hug is very important that toddler gives you, right? Because they're showing that they understand how you feel. Play, again, I'm telling you, play couldn't be the most important thing about any level of children. It really does help with their physical and their mental development. It gets them to think and to be creative as they start to play with other children. It helps with that interaction with them. We know that when we are choosing toys, make sure we choose something that's appropriate, that sparks that interest and that creativity, and have them learning something. And again, different sort of plays, whether they're playing together, aside each other, or, they're playing a game that has an outcome to it. And it all is, this girl or this boy's doing this, and I'm going to do the same thing. Imitation, it's feeling, it's touching, in the mouth, everything is all part of play. So toilet training is usually between 14 to 24 months. If it took to 3 years, it's nothing with the child. It's all the childs are different. We know brothers and sisters, they can really be something with each other. If you have a younger child, a newer baby, and an older child, 3 or 4, there's going to be rivalry, and they're going to be, vying for, attention from the parents. Temper tantrums are toddlers. No, 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 me. And that's part of them. And we know if they are upset, they are stressed, something's wrong, they are going to regress. which means they could go back to sucking their thumb or finding the baby's pacifier and putting it in their mouth or getting their favorite blankie and holding it. You know that they will regress and go backwards. And they might be not potty trained. Dental health, extremely important. You know, years ago, they didn't know about bottle mouth and prevention, and they didn't have sippy cups. And my son, the firstborn, who's now what, 38 this year, he had a bottle mouth because he used to carry his bottle in his teeth and it had apple juice in it. And that apple juice rotted his teeth. Even though his teeth were brushed, it started that. So making sure that we do good dental care and teach them young how to brush their teeth is so important. Again, nutrition during toddler ages goes down to hardly anything, and they call it physiologic anorexia. I know my husband used to watch my grandson when he was in this age, and I'd come home from work and he'd say, you know, all he had was, you know, half a banana and a piece of cheese today. I'm like, okay, that's good. And he looks at me, you know, he needs to eat more. I said, toddlers, they go through this stage and they're not going to. When they're hungry, they'll eat. When they start to go through a growth spurt, you'll see them eat. So don't be upset. As long as we're going in the right direction, you know, it's still, we're eating. That's all that matters. Sleep, you don't need as much, but still they need their good 10 hours a day. And again, dermatitis at this age, to treat it, and it might be foods that are causing it. So to think about it. Safety promotion, prevention, motor vehicles. Well, of course, put them in a car seat. Make sure that you protect them from pools, handles on the stove, the pots on the stove should be facing, you know, inwards, and being careful of fleas and wasps and bugs, et cetera, et cetera. All of these things, you know, protect your child and the sun, of course. So in the case that these children tend to swallow something, and as I said, probably the most common of one that they do are their chewable vitamins. They just love them. They think they taste good, or their chewable ibuprofen or Tylenol. So always have this number at the bedside. In fact, you know, if you work in pediatrics and work in a triage area, the child takes something, you're going to be calling poison control and reporting it and find out what is the up-to-date latest treatment for whatever that they have done. You know, and lead poisoning, we know that
I have
older,
that number memorized.
yeah, I'm sure you do. It is, and they're very good, and they respond to you, and then they call back to make sure you're okay. So it's a really good program. It's out of Jackson Memorial Hospital down here, Ariel. I knew some of the nurses who worked for it. It's pretty cool. Heavy metal poisoning, we know this is in older houses and older areas. Not every area has it. So, I mean, lead poisoning is real and it is a danger. And then preschoolers, ages 3 to 5. This is their growth is slow still. It's stabilized, maybe gaining 5 pounds a year, 2.5 to 3 inches a year height. And they're now getting more mature and stabilized. And these children are better with change. Remember, toddlers like their routine, their rituals, but a preschooler, you can change it somewhat and they're not going to get stressed out with it. Their gross and fine motor, ages 3, 4, and 5. They can walk, run, climb, jump. Their coordination is getting much, much better. They're starting to be able to dress themselves and drawing. Remember, initially at the age 3, they may put their shirts on backwards, their shorts on inside out. It's the attempt that they did it, not that it was done right or wrong. They're starting to be able to draw. They're starting to be able to color. Some of them even writing their names. Erickson. So Erickson now is sort of familiar to Kohlberg in a way, okay? Because Kohlberg talks about right or wrong and a consequence for it, okay? But Erickson also talks about that learning that right and wrong, which means when they do something that is wrong, they know it. And many times later on, they'll tell you, for instance, my little grandson, I had just redone my patio, had the house painted, and he took a permanent magic marker, went outside on the patio and drew all over one of the posts. And I didn't see it initially. So at dinner, very casually goes, "I'm sorry, but I drew on the wall outside." So he knew there was wrong and he knew there was a consequence for it. So he knew that he needed to tell me all about it. So they feel guilty. They're anxious and they fear the consequences for doing wrong. Piaget is right now is not all about self, ego, self. It's more about what's around them, okay? And they're starting to understand things. They're starting to understand why they have to do things for other people. My grandson understands, he just turned 5. So he's been understanding now for a year. He comes to visit Nana, he has to do a COVID test before he comes here. And he hates it. He hates it up his nose. He's about, I do it for Nana to keep her safe from the virus. So that's understanding. Younger than that, they just like, why are you jamming that in my nose again? But now they're understanding. They are now understanding how to speak, how to communicate. Their language is getting so big, but the time, they do not understand it's 4 o'clock in the afternoon. They understand we're going to eat dinner soon. Or when he comes over to visit me, he's going to stay here for 3 morning times, which means he sleeps over and morning will come 3 times. So he knows that's 3 days. So it's when you're explaining time to them, tell them with something they realize. When you wake up in the morning, we're getting in the car and we're going for a ride and going to see whoever. This is what they understand. After your nap, Nana will be here or will do whatever. That's how they understand their concept of time. And magical thinking, they think about everything. Ever watch a child play and they have little trucks or dolls and they're floating and they're talking to themselves and putting them together? This is all their magical world that they're creating. So here's Kohlberg. As I said, there is doing wrong and then knowing that they are going to have some sort of consequence for it. So they know good and they know bad. And they know if they do good, there's a good consequence. And if they do bad, they know that there's going to be a consequence from that. That's what that means. So now, body image. They're starting to look cool, as my grandson says. He's got his little Nike shorts and shirt on. He goes, I look really cool. I got pockets and I got a pocket in my upper shirt and I'm cool. Oh, and my sneakers, they're lights on and they run good. It's understanding their body appearance. They know there's different in types of people. They know if there's, African American, if there is somebody who has freckles, someone with curls, with blue eyes, brown eyes. They're starting to understand that. And usually the child forms a strong attachment to the opposite sex parent. So boys like girls and girls like boys, very much like that. They now don't want you watching them getting undressed or going peeing and pooping. They don't want that no more. Close the door, get out, and they want to do it themselves. And they're exploring themselves, in their private parts. And it's just part of the growing up. And then they're starting, especially if mom wants to have another child, about sex. What is sex? How does that happen? And remember, these children are 3 to 5. It's something that grows in mommy's belly. So social development, they're starting to understand the children. They get their friends at school now, especially in the preschool. They're not as afraid of strangers. In fact, some of them are not afraid at all, and they're too darn friendly, so you get afraid with it. They like to have certain things around that makes them feel secure. Their language is unbelievable, that the way that they can express themselves. And it's like the age 2, they could hardly even speak words. By the age 5, it's getting extremely clear. They are not into that ritualism. They're not into the no, 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 me, me, me. They can dress themselves and they love to please Nana. They like to get their jammies off. And like my grandson goes, gets his jammies off, goes put it, you know, in the clothes hamper and gets dressed with another pair of clothes, comes in and is really happy that he did it all the right way. Can you imagine that? When he started doing that, I was just so happy. He just wants to please. He wants to do things to help you. He will try to push the limits in every manner, but he knows the good and the bad and the consequences for each. Again, play. Okay, I can't go over play any more than I have. It's very, very important. Sex education, again, correct atomic words and be honest. They have a question, answer it. And again, this masturbation is occurring, you know, and you might walk into a room, you might see something, just turn around, walk back later. It's normal. It's nothing to be ashamed of. It's not nasty. It's not dirty. It just is. Unless he's doing it in the middle of Publix, you know, that's something else, but usually it is in a private area. They're afraid of the dark. They're afraid of ghosts. They don't want to be alone. And they're afraid they're going to be annihilated. Like they're just going to be, their body has the blood, it's got a cut, and he's going to bleed out and bleed all over the place. This is what these children believe at this age. You know, we say that, you know, tell him to go get his jammies, my grandson, you know, he just turned 5, so he's right here at this age. And I will say, go get your jammies. He says, no, it's dark. I said, well, turn a light on. He says, there's a ghost in there. I said, have you ever seen a ghost in my house before? He says, Nana pop up, we kicked them all out. So just go ahead. Tell me if you see one, we'll come in and get it for you. And of course, there never is. And it just helps them get through it because, you know, it's just part of that age. If a child is unable to speak correctly, this is early intervention. Getting them into speech therapy can really, really help. Sometimes it's due to ear infections and unable to hear that well. And again, if a child has a problem with speaking, have the hearing tested because it could be the hearing that's going on. Again, early detection is crucial. These children can catch up very quickly. Nutrition, nutrition, nutrition. This is basically about the calories and the fluids that they need, you know, and we know by their weight, are they having too much? We do know that. If they're having too much, too little, we will know. Sleep, about 12 hours a day. You know, these children will not want to go to sleep at night. They're going to fight you with it. You know, it's just part of who they are. By the time they're late school age children, they don't care. They're tired, they go to sleep. But there should be some sort of bedtime ritual, which is whether reading a book or cuddle with mommy or daddy, whatever it is. And these children also need to have some sort of fun in their lives, some sport, something they like to do, and then giving them time to either watch TV or work on their iPads, whatever. But again, iPads, TV shouldn't be their primary source of activities. We know children can be abused. It's just part of life. Probably the hardest thing I've worked with in pediatrics. I mean, I've watched many children, you know, go through a lot of different things, but a child who's been abused and you know it's abuse, it's very hard to work with that parent because you as a person want to say, what did you do? But it may not have been them. It may have been somebody else. So you just put on your professional face, and your job in abuse is for you to make sure the child is safe. I had a 3-month-old baby who came in to the emergency room. I was in the trauma, into the triage area, and there was this purplish little spot and swollen behind the ear. And I went to pick the baby up out of the mother's arms, and I felt my fingers squeeze the scalp. I knew it was broken. And the kid cried. I went, oh boy. Weighed the child, gave it back, did all my assessment, went into the emergency room, told the lead doctor, this child, I think it's abuse. You need to do a bodygram, which means x-ray of the whole body. And it found out that this child had a fractured skull, fractured ribs, fractured humerus, fractured femur, all at different levels of healing. And the kid was only 3 months old. So my goal was to keep that kid safe, and it's what I did. And we called in the services, et cetera, et cetera. In the end, it was the father who had done it. And of course, proper things were done for him. And again, sexual abuse does happen. And again, trying to do it in a manner that doesn't make this child feel bad, because of course the child always feels that they did it. Neglect is anything physical, emotional abuse, could be no food, clothing, shelter, supervision, medical care, education, or nurturing. And all of these can affect the child. And you sort of can see that withdrawn child. You could see when you walk into a pediatric, office, you're seeing a child who is dirty and dirty nails and nails not kept and too skinny, or you can, hair is dirty. These are things that would make you ask more questions, about the child. Again, in children, as a nurse, your job is to keep the child safe. So we've talked about sleep, nutrition, dental, immunization, theorists, milestones. So let's do our Kahoots now, okay? So have everybody done a Kahoot before? So go to Kahoot it. Who wants to win today? I think there's 50 questions today.
How do I access the last one? Because
I sent you the link.
the link you sent, I copy and paste it and it says wrong.
Okay, I'll do it again for you.
Thank you.
Now I'm going to be sending this recording to you, and I have made a YouTube channel. So I'll be sending you that YouTube link, and it's going to be an easier thing for you to look at. And also in the notations, it will be also that Kahoots link for you to click into. So I'll make sure you have that also for week 1, okay? And let's get going. We need to go. Infants, toddlers, preschool. What factor predisposes toddlers to frequent infections like ear infections, tonsillitis, and upper respiratory infections? So we know infants are small, they got little tiny stuff, but toddlers, with all of this swapping of spit, like I said, there is a really short, straight ear structures. We got these big, thick tonsils. They got this mucus which drips on the tonsils and it adenoids, and it doesn't go down, so it goes up into the ears and then it drips and it causes these upper respiratory infections. And that's why they have a lot of them. And all that swapping spit does help. And here we go. We got a game. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning, what? Again, Kohlberg, right and wrong. That right has consequences and so does bad. So either or does. Good. Ages, infants ages 0 to 18 months receive pleasure from biting, eating, chewing, and sucking. According to who? And this is the thing that helps them soothe themselves. It's like a self-soothing thing. Whether they're biting and eating a pacifier. Pacifiers are big things in infants. And it's Freud. That's the beginning. Now, sensory motor is Piaget, yes. But this biting, eating, sucking, chewing, all about oral is Freud. The beginning stages of Freud is all about oral satisfaction. And Ashley popped a top. Which nursing action is appropriate to teach a preschool aged child about a scheduled procedure? So you need a child to come in and is going to be getting an X-ray test that requires IVs and sedations and whatever. What do you do? So absolutely, you're going to use a doll. You're going to show them the instrumentation. You're going to let them touch it, feel it, so they know what it is, so they're not afraid of it, and explain what's going to happen. Remember, your preschoolers aren't as, needing the routine as much as toddlers. Toddlers are harder to teach. Preschoolers are easier to teach. A multi-select. What are some findings from a pediatric physical assessment? Physical, not just your regular nursing a history. No, physical. So when you're talking physical stuff that you can touch, you can feel, you can hear, it's growth, height, weight, and then listening to the lungs, the abdomen and pulses, et cetera, et cetera. So yes, good. Ariel's on fire. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? So yes, we're going to let that child play. We're going to play with the child. We're going to show them the equipment, touch it. They're not going to be afraid of it. They can work on you first, whatever works to get that child calm. And again, get on their developmental level for this explanation. What would you suspect if you note that an infant's chin is quivering, the fists are clenched, and they're inconsolable? What do you think? When you see that unconsolable and consolable, that's pain. When you're talking hunger, diaper, all those stuff, they're crying, but you're not going to see that little, oh, they really hurt sort of look, okay? That's the difference. You see pain, you'll see even the legs going up and down. You need to do an assessment on an infant, and you walk into the room and the infant's asleep in the mother's arm. What are you going to do? The child's asleep. What are you going to do? This is a perfect time to look at the respiratory status and listen to the lungs and the heart, because if they're crying, you can't hear as well. So a sleeping child is the best child to do a respiratory and even a cardiac assessment on. By what age should an infant be able to pull themselves up into a standing position? We know the gross motor skills start with the head up, turning front to back to front, up on their knees, creeping on their knees, and then up, cruising around. When should that happen? And that's about 9 months. By 12 months, they should be walking according to, the textbook. Again, remember, all children are different, but that's what the textbook says. When do you switch formula to whole milk? Now, we talked about when to offer food to a child, and that's at 6 months. But now, when do you take them off formula? When do you think?
Can I ask a quick question?
Sure. It's about 1 year old is when they should change it. Go ahead.
Because
Ariel.
I thought you were supposed to switch them to like reduced milk at
No,
12
whole milk.
months.
They need the fat.
Okay, and then when they get to 18, you switch to the
It
reduced.
depends on their weight. Depends
Okay.
on where they are on the growth charts. If they're a little kid, you want to keep them the weight. You want to keep them the calories. You might add a high thing like Pediatric with calories in it for a low weight child. But just overall, whole milk is what they should have, unless there's another condition going on. Good
Okay.
question though, Ariel. Thank you. Before assessing a 4-year-old child, what techniques would you use to approach this child? Now, when you walk in the room, you just start doing something to a child. The child's not going to listen. They're afraid of you because you're a nurse and all we do is give them, injections, which could be some normal children and never sick. So sit down next to them. Go, so how you doing in school? Are you in school yet? Oh, your Batman shirt, isn't that cute? Oh, you got sparkly shoes. Those are lovely. Start with something else, break the ice, get the child comfortable, then say, I need to take a blood pressure here. Look at it. You want to touch it or you want to do me first? And can you help me by pushing the button and make it work? I'm telling you, the kid will be right with you because you didn't just go directly in to try to do something or say, I'm going to do this. It won't work. Trust me, it won't work. What technique can be used to examine a toddler? Toddler, ages 1 to 3. So there is no head to toe assessment on children. We do what we assess because it works the best. Like, usually you would start maybe with, alert and oriented on an infant, but that one with a sleeper, we're going to do respiratory first. So that can be whichever way we can do the assessment. Now, when you are talking with a toddler, if we say, do you know where your ear is? Which one? Oh, look at that. Where's your nose? And then we can start doing assessments on these children because now it's been part of a game that's not threatening anymore. Good job. When assessing a healthy child's lymph nodes, what should you expect? So in a normal, healthy child, you should not be able to feel anything. should not be able to feel anything. It's only when they're sick do you feel them swell up, okay? When walking into an exam room, you see a 2-year-old rubbing a stuffed animal on their pubic area. Intervention, what do you do? So we know that it's very normal sexual exploration and masturbation in children. If you see that, it's not dirty, nasty. I'm just going to say, you know, so I need to do something. I'll be right back. Turn around, come back a couple minutes, and that's okay. It's absolutely normal for this child. A parent of an 18-month-old boy says that he says no to everything, has really rapid mood swings. Normal, not normal. It's a toddler. What do you think? Absolutely normal. No, 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 mine, 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 me do, me do, me do. And that's all part of a toddler. Absolutely normal. If they didn't do it, I would be wondering what's wrong with the kids. What is descriptive of a preschooler's understanding of time? Preschooler, ages 3 to 5. Remember, he knows after he wakes up from his nap, he's going to go for a car ride. It's a time with an event. It has nothing to do with what the numbers of the clock are. He has understanding of time, but it's only related to events that he understands. A multi-select. How do you place a toddler on timeout? Toddler, ages 1 to 3. So it is 1 minute for each year of age. They need to know why they're placed on timeout and what are the rules and behavior that they need to do during the timeout. No screaming, no yelling. When you stop crying, we will start the time. And that's the way it should be done. A 1-month-old infant's back of the head is flat. What would you tell the mother? Again, put them on their tummy when they're awake and alert, and that will help the head. And it actually does decrease the flatness in the back of their head. As I said, those scalps are very soft and pliable. Infants crawl before they walk. This pattern of growth and development is called what? And it's called sequential trends. This is a normal sequence. Doesn't mean that they can't skip one of the trends, but it's all in sequence. We know they'll lift their head first, and then they're going to roll, and et cetera, et cetera. This is all sequential trends. What is the risk factor for physical or developmental delays for an infant? Why would an infant be delayed? And we know prematurity is the biggest risk factor because they're born early. It could be a delay with hypoxic episodes, cognition, could be delayed with their nutrition, all of these things, all risk factors. They could have bled into their brain because they're so fragile. Again, risk factors. How do you communicate with parents that do not speak a language that you know? Again, we're going to use that telephone interpreter. We're never going to use the older brother or teenager or the parent's friend. No, because they'll put their own bias into the translation. So always we're going to use a proper interpreter. What age would most children could understand under, on top of, beside, around, and back of, over, beside it? Go get your shoes. They're behind the couch. They're under the chair. And it's about 4 years old when they start to understand it. Now, there are children at age 3 who get it, but according to the book, it is 4 years old. Again, another developmental milestone that they should be making somewhere in their preschools. In terms of language and cognitive development, a 4-year-old child would be expected to do what? Now, your 4-year-old is your preschooler. And they should be able to follow those simple commands. You know, there might be in preschool, come on, let's get up and let's make a line, let's go to lunch. Or at home, take your shoes, put them by the door, go take your clothes, put them in the basket, whatever. They need to be able to follow those simple commands. The first expected fine motor developmental milestone for infants begins with, remember, fine has to do with hands, gross is motor. Remember, F, fine, F, fingers. Gross motor is get up and go. So we know that the first thing an infant does is when you put something in their hand, they clasp their hand around it as in a reflex. Reflex palmar, voluntary palmar, crude pincer, neat pincer, and then it goes into putting objects in a container and building a block of 2 by age 1 year old. That is a gross motor development, okay? So fine motor development, it has to do with using your hands, fine motor, fingers. Which statement about toilet training is correct? So usually, I mean, bladder training is definitely before bowel, but why? Because usually these children, if we think about them, these are your older toddlers. They want to please, right? They want to please. So that's what motivates them, that pleasing mom or dad. A toddler parents ask the nurse for suggestions on dealing with temper tantrums. Your kid's having a fit in the middle of Publix. What are you going to do? Or the grocery store, whatever your grocery store is. The best thing to do is ignore the behavior as long as they're not going to hurt themselves. So if they're having a fit, say, okay, lay there. I'll see you. Bye. Keep going. The leading cause of death during the toddler period is Remember, toddlers are the dive bomb kids with absolutely no filter. It is injuries, absolutely. And then you ask what sort of injuries is the most? Motor vehicles in any age of children. A 2-year-old has difficulty in activity, sensory sensitivity, and only speaks one-word responses. Assess what? How do you assess that? I mean, there's little clues here that are telling you that this child is 2 years old and there are things that aren't normal. Most 2-year-olds love to be hugged, loves to be touched. You know, they like to play with themselves with their toys in some way. And it's autistic, what you are going to see there. We're going to learn more about that as we go along. But the autistic child is that child who doesn't like to touch, who doesn't like to, you know, be around people and noises and lights, etc. So that is a checklist that we can use for the autistic child. Parents are concerned the 8-month-old child is not developing like their older child. What is normal for 8 months? So at 8 months, they should be sitting alone, unsupported, and about that age. And remember, all children are not the same. As long as they're doing what they're supposed to be doing according to, you know, the textbooks, they're okay. And as long as they're moving in the right direction. Ashley's back on top. What motor skill is expected of a 4-year-old child? 4-year-olds, what should they be able to do? And they should be able to button a shirt. Those motor skills, actually fine motor. Skipping is later, tying shoes is later, and walking upstairs is actually a little bit earlier with alternate feet. Buttoning a shirt, they should be able to do that by age 4 years old. A lot of these things are difficult. There's so many growth and development, so I'm hitting the ones that you might see. Car seats can safely switch to the forward fronting position at what age? You know, I had a really hard time with this with my grandson because he was a peanut. And when he was at the age that we could switch it, he weighed less than the weight should be. I think they said weight of 30 pounds and he only weighed 24. But the age is 2 years old. They should be able to switch it forward facing. It's because they have the strength, the ability to be able to sitting that way in case of an accident. That's why they will have more head control, etc. The second fine motor developmental milestone for an infant begins with fine motor fingers, fine motor fingers. So the first one is reflex palmar grasp. The second one is voluntary. I want that rattle, or I want my mommy's finger, whatever's coming at me. RN doing a developmental screening on a 10-month-old should expect which fine motor skills from the infant? Fine motor, again, remember, fingers. What do you think they should do? So by 10 months old, they should be able to do that voluntary grasp the rattle and start using that pincer grasp. I mean, I think of pincer grasp, I think about Cheerios on a high chair and how the kids like smash their fingers first and into their mouth. And then all of a sudden they're able to take one at a time. And that's, I think it's really cute to watch. Ashley and Ariel are having a fight. Frequent developmental assessments are important for which reason? Why do we do these assessments? Every single time we see a child, whether it's in a doctor's office, an ER, urgent care, it doesn't matter. We do these assessments. Why? Because we can find out if they're not meeting milestones and they're not advancing, something's wrong. We can identify that delay or that deficit, and we can do an investigation, and we can institute early intervention and bring that child back up to where they need to be. A multi-select. An infant searches for her toy that is not in sight. What is this called? Absolutely, object permanence. It also has to do with memory development, and it's also being able to do things by themselves without a caregiver. So they're a little bit more independent. That object permanence is there, and it's developing their memory. All parts of the things that we do with this play that we do with children, infants. The natural physical developmental sequence that most children follow is what? Or you could say the gross motor skills, the developmental sequence of gross motor skills are. So we start with the head, and then it goes roll over, front to back to front, creep, crawl, cruise, and walk. And all of that should take place within the first year of life, or at least moving forward in that progression. Which observation leads the nurse to be concerned about an infant's mental health? We can tell about infants' mental health very early. How? And it has to do with that trust, mistrust,
still-
and Erickson.
I'm sorry, are we still doing the adaptation,
What do you mean?
the lecture adaptation, or
The attestation, yes. Every time we go to class, the attestation must be filled out every week. And you will get a message from me if you haven't. I want to make sure that you did your check, so to make sure you're not dropped out of the class for non-attendance. So, a mental health, an infant, these children don't want to look at you anymore, and they're not going to look at the parent. They're not going to look at you. They're going to be looking somewhere else and seeing distance. That's not a normal response from a child at all. What would alert the nurse to hold the oxygen on an infant she's caring for? What would alert that nurse? I'm going to give dig to an infant. What do you do when you give digoxin? What are things that you need to do before you can give it? What do you check? So we know a digoxin level of 3.5, absolutely, absolutely. But that heart rate of 90 before we even knew about that dig level would absolutely be that sign. Because an infant should be where? About 140, 160, and it's too low. It'd be like giving a digoxin on an adult with a heart rate of 50. In general, an infant should triple their birth weight about what months of age? So we double at 6 months and we triple at 12 months. Very good. Very important to know those things. When an infant's toes spread when the soles of their feet are stroked, this is called what? And it's just like adults, Babinski. Rooting is when you take and stroke the cheek and they look for their milk. Startle is when they jump at loud noises or their cribs being hit. Or grasping is when you put something by their hand in their palm. They want to grasp it. A 4-year-old is reluctant to take medicine. What intervention should the nurse take? So we know that a 4-year-old is going to do these things and say they don't want it. So what we need to do is tell them we are going to take it. You could do it this way or this way. Which way do you want? You want a syringe or a cup? And that's the only way you have a choice for. So being straightforward and not trying to let that child have any sort of strength over, yeah, I'm not taking it. Like, we know that medicine needs to be given, and there are times where it's very difficult. There are tricks you can do, but I'd prefer not to have to do them. Holding their nose and putting it in the side of their cheeks and squirting it in, many things. Immunizations for a 4-month-old infant. Which action should the nurse take to provide atraumatic care for the infant? So we're going to be giving a shot in this infant's vastus lateralis. And, it hurts. So what can be done to stop the pain? And that's putting that little sugar water on the pacifier. We use that for blood draws. We use it for circumcisions. We use it for immunizations. Whenever we have to hold a child to do something to them, let me tell you, it is a stress reliever and it's a self-soothing for the child. According to Piaget's stages, infant development in the blank stage occurs in 6 sub-stages. Infant, the key word here is infant development. Piaget, what is that stage? So we read the question, and Piaget has many, but when you go back to infant, it's the sensorimotor, right? And we know that sensorimotor in the oral gets confusion with that Freud, because Freud is everything in the mouth, sucking, chewing, those things, everything oral. But this Piaget infant is sensorimotor. What are the common illnesses in the toddler's age? We discussed part of this already. And we know toddlers, ages 1 to 3, all they do is swap their spit, everything in the mouth, everything in their mouth. They're sharing germs. It's all the upper respiratory ear infections, tonsillitis, yes, all because they're short areas and because they're sharing their germs. Which intervention helps a hospitalized toddler to feel a sense of control? Remember what toddlers like to keep them calm. And that has to do with rituals, routines. They love routines, and that makes them feel a lot better. Having some of their own toys or clothes or pillows helps, but it's that routine. An RN is assessing a 2.5-year-old toddler. What findings should you report to the provider? And we know head exceeds chest is absolutely the one that we should. That's why I've mentioned it several times. A multi-select. What are risk factors for SIDS? Now, SIDS also has other risk factors. Males more than females. When you're born and you have low APGAR birth scores, that is another one for SIDS. And again, smoke is always that thing. Breastfeeding is actually something that prevents SIDS. Actually, they tell you to breastfeed because the incidence of SIDS is far less than those who do not breastfeed. What are the common fears of a preschooler? So mutilation, separation, abandonment, dark, ghosts, all of those things. That mutilation is, again, you cut them, they're bleeding, their insides are falling out, they're going to bleed to death and die. That's why Band-Aids are such an important thing for a preschooler. Which concept reinforces the development of sense of trust for an infant? Sense of trust. They know what's coming and their needs are constantly met. It's their sense of trust versus mistrust, right? What does the rooting reflex enable the infant to do? You know, many times when you are working with the premature infants in the newborn intensive care, what you'll do is you'll take and you'll rub that little cheek for that rooting, and that's, oh yeah, I need to eat now. And they go looking for the bottle or the breast for to eat. I've seen it work so well in these little guys. A multi-select. A child's been admitted with profuse diarrhea for 2 days. What would you expect? Now, I want to let you know that your HESI has quite a few questions on acid-base balance. So understanding them will help you. I believe there was 3 or 4 questions that I saw. So we know that if you are having diarrhea, you're going to be losing fluid, which is your potassium. Also, you go into metabolic alkalosis because of the acid that's being lost. So these are things that you do expect. So again, make sure that you are reading up on acid base. Multi-select. An infant's unable to take a breast or bottle for feedings and has an oral gastric tube in. What's important to remember for this child? You know, many premature children do have these tubes in because they're not capable enough to suck, swallow, and breathe, you know, with a bottle. Now, we're going to check those tubes for sure, but make sure that when we're feeding them, give a pacifier to them and they get that feeling that they are doing something for the food. And remember, pacifiers are self-soothing and it helps the child keep calm and decreases stress, less burning of calories, which is what you want to do. What does an infant start to do at 3 months old? Again, this is another gross motor. Get up and go, gross, G. And we know they should go from belly to back. Belly to back should be done then. And Ashley's up on top. What does an infant start to do at 9 months? One more question. So this is when they should be able to stand up and like walk around the couch. They should be able to pick themselves up there or on a walker. I've never seen a walker work for a kid unless they're older, but walking around the couch, coffee table, etc. They should be able to do that at 9 months. An infant's first form of communication is, last question. They should cry and they should coo. Absolutely. Good job. All right, let's see how we get that today. Number 3. Kristen, good job. Number 2, Ariel, good job. Whoop, whoop. And number 1, Ashley, good job, guys. Number 4, Elle and Courtney. So that was good. I want you all to sign your attendance attestation forms. Please get those done. Very important that you do to get those there. Anybody have any questions? Did you like the way you had lecture and an immediate quiz on what was going on and reinforcing what you've learned and the explanations that go with them? Now, if anybody has any questions, needs any more help, please always just let me know and I will help you. If you do want to start your project, just let me know what you want to do it on and I'll give you the go so you could start, because I would do it if I was in your shoes. So thank you for a great class. Sorry I went a couple minutes over. I tried really hard. Have a great evening.
Thank you so much for everything.
My pleasure, always.
Thank you.
You're welcome.
I'll shoot you an email.
Yes, sir.
Yes.